Ladies and gentlemen, good day. Today, I want to talk to you about an important but often overlooked topic, pancreas failure. This condition can have serious implications for our health, and understanding its signs and how to address it is crucial for all of us. First, let's get familiar with what the pancreas does. This remarkable organ plays a vital role in our digestive system and helps regulate blood sugar levels. When the pancreas is functioning properly, it produces enzymes that aid in digestion and hormones that control our blood sugar. However, when it begins to fail, we can experience a variety of concerning symptoms. So, what are the signs of pancreas failure? One of the most common symptoms is severe abdominal pain. This pain often starts in the upper abdomen and can radiate to the back or chest. It can be particularly intense after eating, which can make mealtime quite uncomfortable. Alongside this pain, many people experience nausea and vomiting, which can further complicate matters. Another significant symptom is related to our digestion. Individuals with pancreas failure may notice digestive issues, such as diarrhea or greasy stools. This occurs because the pancreas isn't producing enough enzymes to break down food properly. Additionally, unexplained weight loss can occur as our bodies struggle to absorb the nutrients we need. It's important to pay attention to these signs, as they can indicate that something is seriously wrong. Another sign to be aware of is jaundice, which is the yellowing of the skin and eyes. This symptom can arise when the bile duct is blocked, often a result of pancreatic cancer. Lastly, many people with pancreas failure report feeling a sense of fatigue and weakness, common indicators that our body is fighting hard against a serious condition. Now that we've discussed the signs, let's explore what could lead to pancreas failure. Conditions like acute or chronic pancreatitis are common culprits. Acute pancreatitis can be triggered by gallstones, alcohol abuse, or high triglyceride levels. Chronic pancreatitis, on the other hand, develops gradually and can lead to long-term damage. And we can't forget about pancreatic cancer, a more severe condition that can block the pancreatic ducts and impede function. So, how do we address pancreas failure? Well, the treatment really depends on the underlying cause. For acute pancreatitis, hospitalization might be necessary. Here, medical professionals will manage pain, hydration, and inflammation to help the pancreas recover. In the case of chronic pancreatitis, many individuals benefit from enzyme supplements to assist with digestion, as well as medications to manage pain. Lifestyle changes also play a critical role in treatment. For instance, avoiding alcohol and smoking can significantly reduce the strain on the pancreas. Following a low-fat diet is another smart move to ease the burden on this vital organ. In some cases, surgical intervention may be necessary, particularly if gallstones are blocking the pancreatic duct. And for those dealing with pancreatic cancer, treatment can include surgery, chemotherapy, or radiation, depending on the stage of the disease. In closing, I urge all of you to be aware of the signs of pancreas failure and to seek medical attention if you experience any of these symptoms. Remember, early diagnosis and treatment can make a world of difference. Let's take good care of our bodies and support each other in maintaining our health. Thank you.